Yes, good evening. This is Dr. Soleman, another session of Your Health Today, My Media Prime, live, Saturday, 5 p.m. Welcome and nice to see you this weekend. It's a little bit raining outside. We're going to discuss something new, and we're going to discuss with you also something that is we all subject to, even though we have discussed it before, but it seems like it is very much repeating. You know, we see a lot of cases with what they call palpitation, especially in young ladies. Palpitation, the patient will come and complain about racing heart rate, and when you see the patient, the heart rate is normal. So the patient will explain to you that, I feel like my heart is jumping out of my chest. This is how bad it is. The heart is bouncing too bad in the chest. Sometimes you sweat, and especially in young people, right? In especially young ladies. You have fear, you have anxiety, and the heart is just bouncing off. So in this case, when you go to a clinic with this scenario or a hospital, what they will do? They will refer you to a cardiologist because you're complaining about your heart. So they do the ECG, they do the echocardio, you spend a lot of money, and at the end of the day, they tell you, listen, everything is normal. There is nothing wrong. And believe me, this is a very common scenario. So we're going to discuss in the next few minutes what's happening there. You know, again, you feel palpitation that's on and off. At times you are fine. Other times you feel palpitation, you feel like you're afraid, you feel like you're anxious, but you don't know the reason. There is no reason. And sometimes this palpitation can wake you up from sleep. So it is bad. In medicine, we call that panic attacks. Panic attacks. And it is a form of anxiety. Now we will go in depth a bit. We will go in depth a bit. Anxiety is worrying all the times for no reason. You just worry all the times about the smallest thing. You start to get worried. You're emotionally vulnerable. Small things make you very emotional. Emotional response varies from one person to another. And let me tell you something. You know, the most common reason for those who get heart attack, if you analyze their personality, you know, you'll find out that those who are emotionally sensitive, they react to all emotion severely. Those are the ones that are most likely vulnerable to heart attacks. Real heart attack, not just panic attack, no, real heart attack. So, can we control our emotion? It's difficult. So when we categorize people, those who are emotionally sensitive, emotionally, and severely responsive to different emotions, are the ones who are at very high risk to get a heart attack. But those who play it cool, they don't get bothered much with emotions. Those are the ones that have very low risk to develop heart attack. So when we talk about panic attack, yes, it could be cardiology, it could be heart problem, but in a young lady or a young man, and mostly young ladies, when we have this repeated all the times, and you go to do the ECG and you check your heart and the heart is absolutely normal, you don't have a problem, then this is a different diagnosis. In medicine, we call it panic attacks. Psychiatrists like to call it panic attacks. But we never really ask ourselves, what causes the panic attack? Yes, you put a terminology on it. You said it's panic attack, and that's what we teach our young doctors. Listen, it's called panic attack. When there is no cardiology behind it, when there is no heart problem behind it, we just call it panic attack. But what causes the panic attack? It's the the fear of the unknown. You're just afraid. It just happened. This is when medicine failed to explain certain phenomena or certain disease. They just blame it on something that does not really make sense. An anxiety, fear of the unknown. You're afraid, that's why you're anxious. But why? What triggered that fear? Should be the most logical question, no? Why are you getting afraid? Why not all people getting afraid? Why only certain people getting afraid and they have fear and they develop the panic attack, but others don't? Medicine, explains it so people think that doctors are smart. But the reality of it is much deeper than that. Most of the patients, see, in medicine, we observe and we document and we see. So I have noticed the following. Those who are spiritually vulnerable, those who have spiritual problems, are high risk to develop panic attacks. So in medicine, we call it panic attack, but if you look deeper into what triggered this panic attack, you will find out it is not really the panic attack itself. It is not the panic attack, rather, it is a spiritual attack. And there is a spiritual cause for it. When I say spiritual cause for it, that means there are entities that you do not see that have triggered this attack. And that is the most logical explanation for a spiritual, or what we call in medicine, panic attack. It is no such a thing as panic attack without a cause. Everything that happened has to have a reason. And when we fail to find a reason, we just blame it into something else, and we put a fancy medical term on it. This mic is not sticking. Anyhow, so let's take 1 minute break till I fix this mic, and then we'll move on. Let's take 1 minute break.
When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soleman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by ELISA just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at mile 18 Bomaka. In Vola, you can find us at Bonaberry, precisely at Entrepilot. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soleman.
Okay, so we talked about panic attack and the reality of panic attack and what doctors call panic attacks as panic attacks because they have no other explanation. Panic means you're extremely afraid. You're extremely afraid attack. That's what the medical definition is. And they say, it has physiological evidence. You have physical evidence, which is the tachycardia, which is the very increased racing heart, the diaphoresis, which is the sweating sometimes, and you just feel like, you don't belong to yourself. You feel like you're gonna die. You feel this is the end of your life right there at this point. And medicine calls it panic attack. But again, to repeat myself one more time, there is a reason for everything. And there is no such a thing as panic attack without a reason. It doesn't exist. Only when we fail, we say it's panic attack because of another form of an anxiety. You're stressed out, thus we get the panic attack. It is not the truth. If we look, how do we know? Because, as a practicing physician for many years, we get these patients, this is my specialty, we get this kind of patients all the times. They go to cardiology say everything is okay. They do echo, everything is okay. They do ECG, everything is okay. So there is no medical reason that the heart has a problem. So that is why, by accident, okay, go to the psychiatrist then, or the neurologist or somebody who knows about nerves, and then they come to us, and then we find out that actually it's a panic attack. But how can you explain a panic attack? You cannot explain it. It's just an extreme form of an anxiety. Okay, but this is not enough to know why we're having panic attack. Because once we know why we're having panic attack, we can treat the problem at its roots. And that's what we're supposed to do. So again, I repeat, panic attack is nothing but a spiritual attack, believe it or not. Yes, panic attack is nothing but a spiritual attack. There is no panic attack without a cause. Okay? When we say an anxiety, why are you anxious? Because, well, they explain it, or maybe it's a low state of serotonin. Serotonin is a neurotransmitter in the brain. When it's less, it causes a bit of depression, it causes a bit of anxiety, it causes a bit of insomnia, a lot of other, psychiatric and medical conditions. And we call it low state of serotonin. Why? Because when they seen these people and they did some lab investigation and they measure serotonin, they find out it's low. But at some other points, some other times for the same patient, you'll find it high. So how you explain that? It's only that you have chosen to choose what fits your diagnosis and fits your medical terminology, ignoring the real fact that this serotonin sometimes can go up. How you explain it? You cannot. So medicine doesn't know spirituality. It doesn't. Doctors were not trained for that. It's your observation during the course of, and your experience, your own experience, the experience you go with patients, and whether it works or not. You have gone through a couple of experiments, couple of experiences, and you did few things spiritually, and it works, and the patient recover. And now we know. We document case after a case after a case, and it becomes now an observation that has been documented by studies, and the studies are valid because the patient have gotten improvement without the need for different medication. When we deal with head medication, it has a very bad side effect. If we do antidepressant, what is the major side effect of antidepressant? It causes impotence. Yes, if you're depressed, and we give you antidepressant, it can cause sexual dysfunction, men and women. So would you rather be depressed and sexually fine, or anti-depressed, not depressed, and you're impotent? It's a very tricky question. Yet we have in medicine, we have some kind of antidepressant that can treat you without the side effect of sexual dysfunction. But then again, why are we depressed? Oh, again, the studies have shown that low state of serotonin. But depressed people have always negative thoughts. Why we having negative thoughts? Oh, because this is how they are. We cannot explain that medically, why we have negative thoughts. We're related to the decreased state of serotonin. But that is not the truth. This is just doctors' way out of explaining things that they cannot understand. That's what it is. That's the truth of it. So the more, actually, let me share with you a story, okay? And I have this patient that came in, cannot talk. That was like a month and a half ago. The patient cannot talk for the last 5-6 days. He will not say a word. Previously, he was walking, talking, functioning absolutely fine. He comes to me, he cannot walk. He comes to me with a group of his friends. Patient cannot talk. We tried everything, cannot talk. We took him to a hospital, cannot talk. We did MRI, is nothing wrong. We did CT scan, is nothing wrong. We did all serology, hematology, every kind of medical test that can relate to the problem, cannot talk. We did fibroscope to go inside to look at the vocal cords, cannot talk. We give medication, patient cannot talk. Anti-inflammatory, steroids, strong steroids, injectables, by mouth, by every patient cannot talk. Patient does not talk. And he's been like this for almost a week. I didn't video document this case, but I documented another case that I'm going to share with you and show you. I spent an hour with the patient. Spiritual session. The patient talked. And the nurses was, wow, he talked. Yeah, he talked just like he was talking before. Was no fault medically. MRI was absolutely clean. Vocal cords, and this patient will be subject to a lot of anti-inflammatories, a lot of drugs, thinking that it's a medical cause. It is not. You know, sometimes when we do not want to talk about the spiritually induced diseases, we say, oh, it's psychogenic. That is the escape word to say that there is no spiritual disorder. It is psychogenic. This patient cannot be talking, is not talking because it's psychogenic disorder, meaning is induced from the head. It's possible. Yes, it's a reality, it's possible. But it is not the case. It is not the case. For those who understand the spiritual, and they can see beyond and see the reason and remove the reason and the cause, they will understand what I'm talking about. For the most of us here, that we do not believe what we cannot see, then it's difficult to understand. But it doesn't make it unexisting. It is existing. Now, back to this patient. The patient spent with me 1 hour, and the patient talked. He vomited few times, okay, and then he talked normally. The nurses were like, what? Shocked. So we can call that a psychogenic cause for no speaking, loss of speech. Could be a psychogenic cause. Psychogenic meaning it's all in the head. The patient, for example, could be severely depressed. Depressed people do not talk. You cannot have them talking. But the patient was not depressed. The patient was functioning at every other level. He even came with his friends. He, talked to his friends with signs now because he lost the ability to speak. Okay? But after 1 hour of spiritual psychotherapy, the patient spoke. 1 hour, the patient is speaking. I'm going to ask Mr. Johnson, my best producer, to please play the second video, not the first video, the guy with the white shirt. Well, actually, both have white shirts. The smaller guy, the second video, that time 15:44. That's one. 15:44. If you please can, this is the one right before the skin lesions. If we can play that video, I'll really appreciate it. No, those are the pregnancy cases. I'm talking about the spiritual ones. Anyway, those are, okay. No, the next one. Yeah, this one here. That's it. One time. Allah نور السماوات والارض الله نور السماوات والارض الله نور السماوات accept the light الله نور السماوات والارض 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 الله نور السماوات accept the light حرمت عليكم الميتة والدم ولحم وكان حقا علينا نصر المؤمنين فقاتل أولياء الشيطان وما رميت إذ رميت ولكن الله رمى وما رميت ولكن الله ولكن الله رمى ولكن الله رمى بسم الله الله أكبر بسم الله الله أكبر أعوذ بالله السميع العليم من الشيطان الرجيم وقاتل أولياء الشيطان فقاتل أولياء الشيطان فقاتل أولياء الشيطان فقاتل أولياء الشيطان إن كيد الشيطان كان ضعيفا وقاتل أولياء الشيطان فقاتل أولياء الشيطان أعوذ بالله السميع العليم من الشيطان أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم نزل عليكم من القرآن ما هو شفاء ورحمة. Talk now. Talk.
It's out. It's out from your throat. It was sitting right here.
It was sitting.
Yes.
Was sitting
Yes,
here.
this
Cannot
is
talk
where it was
because
sitting.
Was sitting right there in your throat. Now you can talk. What's your name?
My name is Ivan. I can see.
That's right. Now you can talk.
Yeah.
Now you
Say
can talk.
thank God.
Thank God.
Yes.
Okay.
That's what I'm talking about. That's exactly what I'm saying. So he couldn't talk. He was not talking. Was entity, and a dark entity, call it the evil, call it devil spirit, call it whatever you want to call it, was sitting right here. For those who have the capacity and the gift to see, We can see it. And as a gift of God, I snatch it. I offer it the light. Accept the light, fine. Leave him alone. If it doesn't accept the light, then you gotta go. You gotta go where there's no return. That's it. You're done. You finish. And that's how it works. So those entities, they can block you from talking. Because the guy was talking before, fine. Like 2 weeks ago, he was fine. He just lost the speech. He doesn't talk anymore. Now he talks. Immediately we removed it. He talks. And that is the same with the other guy. And the other guy was Egyptian even, 3 weeks ago or so in the clinic. Same thing. Same cause. Can you explain that medically? You cannot. What are you going to say medically? The vocal cords are good. That's the MRI is good. Everything medically is good. How do you explain that? You cannot explain it in a medical ground. But we like to choose a term for it. We can call it a spiritual psychotherapy. If you want to call it that, then it's a spiritual psychotherapy. What matters is it works, right? Whether you believe in different entity or not, it works. The boy is spoking. The boy is speaking. He couldn't talk before. He spoke. So can those things block your speech? Yes. What else can they block? Can they block your memory? Yes. Can they block your marriage? Yes. Can they block your ability to have babies? Yes. Can they block you financially? Yes, but I don't care about financially. I'm a doctor. You have a medical problem, then this is when I come in. Healing and healing only. That is what I do. You understand what I'm saying? So there are things that we cannot really explain medically, and the medical explanation for something like panic attacks does not really make sense, because we are asked to just memorize what it is and relate those things to low state serotonin, for example. But we cannot explain why the heart will race, why you get afraid to the point that you're gonna die. That's it, this is the end of your life. What induced that fear on you, so much fear that you think this is the end of your days? We have no explanation. The medical explanation fails to make us accept it in a logical way. It doesn't make sense. So the only thing that makes sense is a spiritual attack. So we have seen just now, he couldn't talk, and now he started to talk. That's the second case in about 2 weeks that we handled. Now, I get another case, okay? I don't have a video of it, but I will tell you about it. And this man is about 30 or 30 something years old. He never spoken in his life. He can barely feed himself. He does not go to urinate or defecate on his own. Most of the times, he does it in his own self, in his clothes. He cannot read and write because he couldn't go to class. He couldn't comprehend anything. And tell me now this is spiritually induced. No, that cannot be spiritually induced. You know why? Because this is mental retardation. And mental retardation are degrees. It could be mild, moderate, or severe. It depends how the patient function in life. So mental retardation, yes, it could be having spiritual element, some, not all. And this, once we remove the spiritual element, the patient improves. We can do few therapies like cupping therapies and other stuff. The patient definitely improve, but we cannot bring the brain that has stopped growing at 5 years old and make it advance 25 years to fit his date and age. If you are 33 years old today, but your brain stopped growing at 5 years, so you have the mind of a child that is 5 years old, I cannot bring you back and move the clock forward 20-something years, so you can be 33 year old in age, and also your mind will be 33 years old. It doesn't work like that. So what is being defective since birth? That is congenital defect. You were born like that. We cannot interfere in this case, and I can say safely, if there is a small spiritual element, it could be fixed. But to bring you back from 5-year-old in your mind to the 33-year-old that you are right now will be very much impossible. It doesn't work. So we cannot fool ourselves and say, okay, it's a magical treatment. What is real, real. What's medical stays medical. What is otherwise stay otherwise. And we cannot treat, medical disorders unless we have the right diagnosis and right treatment. But when there is no explanation medically, then we must think there are other reasons behind the disability that we see. Okay, I will like to share with you another scenario, and that's another case. Let me explain to you about the case, and we spend few seconds in watching this case. This guy also is a young man, and he came in headache that is not going anywhere. CT scan was done, all investigation were done, nothing, everything is normal. He feels like there is water in his head, water moving in his head. That's what he said. I feel like there is water moving in my head. Next complaint, I cannot breathe from my nose. I only can breathe from my mouth. This area is clogged. You may think sinusitis. The patient doesn't have sinusitis. You may think it's kind of a polyp growing here, blocking his breathing. The patient does not have a polyp. I told you all investigation were done and everything is negative. He doesn't have any problem. Medically speaking, all investigation are negative. MRI, I would be able to see if there is anything on MRI, right? MRI is higher class of CT scan, and it's more specific for soft tissue. I will be able to see an MRI. The doctor will be able to make me a report that there is something that trigger the inability to breathe from the nose and can only breathe from the mouth. And he feels there is something clogged in here. And that's a young man. He's been like this for years. No solution. He gave up. He has to live with it. It reflected in his behavior. He easily get angry, because of what he's suffering. He's still young. And this is preoccupying his life to the extent that, is really bothering. Put yourself in his place. Well, how would you feel? You feel like water moving in your head every time. Headache that does not go away. So we play this second video and we'll see together. أينما تكونوا يأتي بكم الله جميعا 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 يأتي بكم أينما تكونوا يأتي بكم الله جميعا يأتي بكم الله جميعا يأتي بكم الله جميعا يأتي بكم الله أينما تكونوا يأتي بكم الله جميعا يأتي بكم الله 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 جميعا إن الله على كل شيء قدير أينما تكونوا أينما تكونوا أينما تكونوا يأتي بكم الله 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 جميعا يأتي بكم الله جميعا يأتي بكم الله جميعا فتقع على طائف من ربكم وهم نائمون وعد كالصارم أعوذ بالله من الشيطان الرجيم هذه جهنم التي كنتم توعدون 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 كلما نضجت جلودهم بدلناهم جلودا غيرها ليذوق العذاب 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 ليذوق العذاب. One chance. Allah نور السماوات والأرض الله accept the light. Allah نور السماوات والأرض الله نور السماوات accept the light. Allah نور السماوات والأرض الله نور السماوات accept the light. Allah نور السماوات والأرض الله نور السماوات accept the light. accept the light. الله نور أعوذ بالله السميع العليم من الشيطان الرجيم وكان حقا علينا نصر المؤمنين. فقاتل أولياء الشيطان فقاتل أولياء الشيطان فقاتل أولياء الشيطان فقاتل أولياء الشيطان هم رميت رميت ولكن الله رمى هم رميت رميت ولكن الله رمى وما رميت وما رميت رميت ولكن الله رمى وما رميت إذ 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 رميت ولكن الله رمى فقاتل أولياء الشيطان إن كيد الشيطان كان ضعيفا فقاتل أولياء الشيطان إن كيد الشيطان. This one is amazing. There are more videos, but I'm not going to bother you with it because it's maybe a bit disturbing. Let me explain to you what's happening there. Whatever dark entity is in this boy, controlling or causing him harm, we snatch it with the power of God, prison this entity into my wife's body, and then I deal with it. I have offered the light, it accepts, fine. It doesn't accept, kaput, finish with the power of God. And that's what we see. So my wife started to manifest exactly like that boy. The head is going to explode. That's exactly how the boy feels. The breathing, cannot breathe only from her mouth. And then she got attacked in the next video, whereby, her eyes, she couldn't even see at the time. Her eyes burning. And as you can see, the waist, attacking in the waist. So when they come with attacks. But in few seconds, they are gone. Few seconds. With the power of God and words of God, they are finished. So this is another example of a spiritual cause that give you medical manifestation, but the answer is not medical, because everything was negative. And we're not talking about one institute that he went to. He went to the biggest institutes. Been around everywhere. Everything is negative, no solution. I give you some, analgesics, I give you some anti-inflammatory, but for what? It won't work, because the cause is not, is not a medical cause. Turn out the story is, this boy, we see a big complex, a big compound, and a girl that does not look like a wife or a girlfriend, going around like begging. We assume is maybe could be a house help or something. Something has happened to that girl will trigger that she become very revengeous, and maybe went to the village and she did what she has to do to take revenge. So most of the time it's about revenge. Most of these cases that happen is about revenge. Somebody's taking revenge on somebody. That's why I'm saying try to avoid problems with people, and the best way is amicable. Don't get anybody upset with you, and don't be unfair to anybody. Same way you like to be treated, treat others. And this way will eliminate a lot of pain. Do not, be nice. And if somebody is not nice to you, try to be nice to them, so you don't trigger anger and revengeous act that are really costly. And listen, you came to somebody who understands the problem. But maybe what if you somewhere else where they do not understand this kind of problems, and they refer to, okay, you need now a surgery in the head, what are you gonna do? So the safest way to deal with those, do not make enemies. It's very difficult to say, and it's very hard to do, I understand. But do your very best to be friendly with everybody, and don't have anybody have those revengeous act against you. I'm quite sure this is not going to stop the problem, because there are people who are just envious and revengeous, and they enjoy when they reflect harm on other people. There is. I mean, who you think did that? Somebody who's nice, or somebody who's devilish? Somebody who's devilish, that enjoy seeing people getting hurt. And the more you get hurt, the more they enjoy it. It is true. And we cannot really say everybody is good and dandy out there and everybody's like an angel. No, there are bad people, there are envious people, but try to avoid. Live a peaceful life. It's hard to say, I understand, because if you are living, you have to mix with everybody. And you have to see the good and you have to see the bad. You have to deal with the good, you have to deal with the bad. And in the process of doing so, you may get hurt. We'll take 1 minute break, and then when we come back, we'll talk about the skin diseases.
Are you facing challenges in your health? Then Dr. Soleman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soleman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soleman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bolifamba, and in Douala, we are located at Entrée Pilote. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soleman.
Welcome back. In this session, we will talk about the skin. And when we mention the word skin, I like to start with the most dangerous the most dangerous skin issues, and nothing is more dangerous than cancer. So we start this session by talking about skin cancer. I have good news for you. As we in Cameroon, we in Africa, the dark skin is less likely to develop cancer in comparison with fair or light or white skin. They are more prone to develop skin cancer. What trigger the skin cancer? Listen to this. What trigger the skin cancer? Sun. The sun triggers the skin cancer. The more sun you get exposed to, the more likely that you will develop a skin cancer. So what we do, if you are a farmer, if you are a construction worker, if you are someone who get exposed to the sun all day, protect your face. Protect the area of your skin that get exposed to the sun. Now that you learned this piece of information, protect your skin. Do not expose your face, especially your face, to the sun. Especially, we have very strong sun. So the more sun, the more cancer. The more sun, the more cancer. The treatment, remove. Biopsy and then remove. Biopsy meaning we take it to the lab, we take a piece of it, and then we send it to the lab, and the lab confirm, yes, it is cancer, no, it is benign. But nevertheless, we have a tumor, we have a growth on the skin. Now, for you out there, how can you tell that piece of the skin, that tumor, that projection of the skin that you have, is it cancerous or is it benign? Benign meaning non-cancerous. How can you tell the difference between the two? Well, in the cancer, we have asymmetry. Asymmetry meaning what? Meaning, if you look at the lesion, it is not round. It is irregular border. You know, it is not round. So if you cut it in half, you know, one half will not be equal to the other half. We call that asymmetry. Asymmetry. So imagine the lesion on somebody's face in your family or so, and or a friend or somebody that you know. If you cut the lesion into half, not cut, like an imaginary line, like a drawing line like this, you find out that one half is not the same size as the other half. We call that asymmetry. And that raises suspicion that this lesion might be malignant or cancerous. On the other hand, if you take that same pencil or marker and you mark the lesion from the middle and one half equal to the other half, that is a benign tumor. That is non-cancerous tumor of the skin. What is the second thing? The border. The border of that skin lesion, if it's irregular, that most likely cancerous. But if it is smooth and regular, that is non-cancer. That is benign. What else? The color. The color, you find color irregularity. What does that mean? You find some areas of the tumor darker than the other areas. That is, we call color irregularity. The color is not even. Like the size is uneven, also the color is uneven. The border, we said, is irregular, meaning ups and down. On the benign one, you will find the colors very much even, same color. If you measure the diameter of that tumor on the skin and you find it more than 6 millimeter, that's a cancerous. If you find it less, that's most likely non-cancer. But remember, a skin lesion does not only grow side to side. A skin lesion can only grow top to bottom, deep into the skin. Yes? So, and when we excise meaning remove, when we wanted to remove this lesion, we cannot remove by shaving, because a lesion is growing on the top of the epidermis or the last layer of the skin, you know. We cannot just shave it like that. You cannot. Especially if you suspect a cancer called melanoma. You know, if you suspect a cancer called melanoma, you have to excise from around the lesion all the way deep. You don't have to bother yourself with that, because the doctor's job is to know this kind of stuff and to do exactly what I'm telling you that he will do. A dermatologist will do that for you. But your job here is to recognize one thing. If you have a skin growing, something that is growing of the skin, and it meets the category that I have just discussed, that is most likely a cancerous. If it meets the categories of non-cancer, then it's most likely non-cancer. Again, to say the same thing, to say it again, you know, a cancerous skin tumor will be asymmetric. One half not equal to the other half. The color will be uneven. One area is different colors than the others. And lastly, the diameter will be more than 6 millimeters. Okay, and the borders will not be regular. And the opposite is just for the non-cancerous. Okay, so let me look here if I have something to show you for this. Okay, maybe we can play the very first one, please, Mr. Johnson. You know, the very first one that has the arrow, the black arrow on it. Yes, this one here. This one here is a benign tumor. Look at the borders. Look at the borders, even. They are very even borders. And look at the color. The color is the same all over the lesion. And look at the borders, they are even. And if you measure it, it's definitely less than 6 millimeters. Okay, this is a sample of benign skin tumor. Benign. Benign meaning is not cancerous. We're going to move on to something called squamous cell cancer. And that is the next image. The next image, right? The next image, the one that looks like some black stuff inside. Yeah, this is it. And this is somebody's nose, believe it or not. This is somebody's nose. And where does it happen? If you notice, this is the nose. And the nose is the area of the face that is exposed to the sun. So this has happened, as we said before. The more sun exposure, the more likely you develop a skin cancer. So this is like an ulcer. And this ulcer here does not heal. And that's what we call squamous cell cancer, is an ulcer that does not heal. An ulcer that does not heal. Okay? So now, let's move on to the next one. Let's move on to the next type. Okay, yes, this one here. This we call a waxy. If you look at the lesion, it's shining. You know, the lesion is shiny and is like waxy. Okay, and this lesion here, we call it basal cell carcinoma. You don't have to worry about the names. The doctor would know which kind of tumor it is. What you should worry about, if you develop something like this in your skin, you should be able to identify and rush to the doctor and tell him we have this lesion in my skin. You know, and the most important thing, so you don't get those kind of lesions, protect your face and protect your skin from the sun. Okay, the sun causes a lot of problems. Like we said, more sun, more cancer. More sun, more cancer. So protect your skin from the sun. We talk about, this is the basal cell carcinoma we have just discussed. And now let's talk about the last image. Let's look to the last image here. And I'm going to have to, this one here. If we look at this kind of a skin lesion here, this is what we call Kaposi sarcoma. Kaposi sarcoma. Kaposi sarcoma, if you see the lesion is purple. You know why it's purple? Because there's a lot of vasculature there. A lot of capillaries, a lot of blood supply to that lesion. That's why we cannot biopsy this lesion, because if we cut this lesion, it will bleed non-stop. If you cannot scratch this lesion, you cannot cut this lesion. This lesion used to happen back in the 70s and 80s on all people who do nothing but sit on the sun on the beach all day, like the Italians, all the Mediterraneans, you know, those people who have the sea in front of them day and night. They do nothing but grab a chair and sit in the sun all day, every day. So, and we found those lesions on them. But lately, we have found this kind of lesions in patients with HIV. So patient with HIV will develop this kind of lesions. Now consider that Cameroon, we have darker skin, so the lesion will still be obvious, and it's like purple, black purple. And purple because of the rich blood supply, the rich vasculature in that lesion. And that is something that you should look out for. We have few of those cases, and we successfully treated them with an infusion called glutathione and other medication. It treats this kind of lesions. Now, if you know it or not, these lesions happen in HIV or AIDS patients. Then when the patient progresses from HIV to AIDS, which is much more advancement in the disease, then we see this kind of lesions in the skin. And mostly from my experience, it always starts in the limbs, in the lower limbs, okay? On the legs, it starts in the legs at all times. We have a couple of patients like this, and when we put the infusion, the lesions disappeared. Now, you have to know that this lesion is caused by something called HHV, which is a human herpes virus number 8. That's the herpes virus causing this lesion. And the herpes virus normally will protect ourselves against it as long as we have good immune system. But those with HIV, especially when the CD4 count goes less or the viral load goes up, they develop this kind of lesion. Okay, do not is ugly. Okay, especially if it extends to the body, and especially if it's a lady, extend to the body, extend to the face, and then it is really noticeable, and it causes depression sometimes to these patients because they don't know what to do with it. Now there is a solution. There is a tablet that you take, infusion that you will take, and it will definitely get it faded away. Faded away dramatically that you don't even notice it anymore. So this is, the last cancer of the skin type that we will be talking about today. We start with the cancer lesions of the skin, and at the end of this session, for the cancer of the skin session, we say again, do not expose your skin to the sun for a longer period of time. If you are a farmer, protect your stuff, protect your skin. If you go to the market and stay in the market all day, also protect yourself from the sun. And it's advisable to get a cream called sunblock cream, a cream that you apply to your face and it blocks the sun. I have noticed patients that come to me and their skin is very hyperpigmented, and I say, how did you get the skin to be hyperpigmented like that? Oh, doc, I have an oil that I rub on my skin and I go outside. So I asked them, bring it. Let me see what's in it, because your skin is too dark. Your face is much, much darker than the rest of your body. What happened? So when they bring the cream and I read the ingredients and I find out it has ascorbic acid. And most of the time, those creams are made here. There is no company, there is no standard, there is no quality control, there is nothing like this. They just make the cream, they buy it for $1,000-$2,000, it's a cheap one, and then it does really a lot of adverse effect. I have let me finish with the ascorbic. We find out that the ingredients there is ascorbic acid, vitamin C. They put too much ascorbic acid there, and when you have a cream that has ascorbic acid, you should read in the ingredient. If it says there is ascorbic acid, do not put this cream and go in the sun, because it will cause you a lot of hyperpigmentation. You will definitely won't like it. You'll definitely, especially on those parts here, hyperpigmentation. This is one of the reasons we find, but there are other patients that have hyperpigmentation in this area here, which is very much the projecting area of the face that catches the sun the most. And this hyperpigmentation, we have a solution for it, and it can go away. But the best is prevention. Do not put those body creams on your face, regardless, because you don't know what's in them. And most of the times, you don't even find the ingredients for those creams that you put in your face, and you go out there in the sun. So if you find the ingredient, look for ascorbic acid, and that's most likely the reason. Because ascorbic acid will react with other components and form what is called aspargyl compound, okay? And that is very bad for the skin. It's not that it's very bad, it just causes hyperpigmentation, which in simple medical terms, it stimulates the melanocytes. Melanocytes are those kind of cells in the skin that is responsible for increasing the pigment, which is melanin. So when we have melanocytes producing melanin, I stimulate their production of melanin by applying ascorbic acid or vitamin C to them that is incorporated into the cream that you use on your face. So I advise the following. If you're going to put a body lotion, put it at night when you're in the shade, because you're not sure what's in that cream. And most of the times they don't mention, there is no even label in the cream to tell you what's in it. Okay, so if you're going to go out in the sun, the only one they can put in your face to protect your skin is something with sunblock. You'll read on them, sunblock. You don't have to put much. Sunblock screen. We call it sunblock screen. And there is a block, sunblock factor. There is factor 2, factor 4, factor 8. And each number reflects the number of hours that this cream can protect you from the sun rays. Okay, so if you go outside, Do the sunblock screen on your face and know how many hours does it protect me. It protects me for 2 hours. That means I have to reapply the cream after 2 hours. Oh, it protects me for 4 hours, so I have to reapply the cream after 4 hours. So the sun, the strong sun rays are very dangerous for us. Yet, the sun for some people are very beneficial. Those who have defect in the liver, you know, the liver is not producing or is not making bilirubin soluble bilirubin, making it direct bilirubin. Especially for neonates, new babies, sometimes we find the bilirubin very high, which is, it causes pigmentation of the skin, yellowish pigmentation of the skin, the eye, you know, and this is bilirubin, that's a pigment. So the best solution for those is to go in the hospital. They have a special lamp, you know, that will dissolve this, decrease this bilirubin by about 25%. That's all, by 25%. Those 25% reduction in bilirubin, because of that special rays that you use, are very beneficial. That we can get also the same thing, early sun, like, you know, 7 o'clock, as soon as the sun comes out. We can use this to reduce and enhance the liver function to get rid of the extra bilirubin, you know. So those are the early hours. But midday sun is no use for nobody. You know, this high sun, hot sun, midday, noon sun, these are no use for nobody. Only early sun is used for those who have bone problems or bilirubin problems from the liver. They can expose themselves to 1 hour, half an hour, especially small babies. Is very useful, but not too much of it. Just like 15, 20 minutes, that's it. But the sun of noon, of 12 o'clock, no, that's no good for anything anyway. And protect yourself from the sun, and stay healthy. And I will see you next Saturday, 5 p.m. Please be there. And if this video, you find this video beneficial to you, it will be uploaded to Facebook. Share it to your friends so everybody can benefit. Thank you very much for listening and watching. And this is Dr. Soleman, My Media Prime, Your Health Today. Thank you, and you have a nice, beautiful, blessed weekend.